In a world where our physical health often takes the spotlight, it is crucial to shed light on an equally important aspect of our well being. It is our mental health. Hey there, Shane! Do you know what exactly is mental health and why is it so crucial to our overall well being?
Well, mental health refers to a person's emotional, psychological, and social well being because it influences how we think, feel, and act. It also determines how we handle stress or how to make decisions. So, basically, it says that mental health is not just the absence of mental disorders, it's a dynamic state that involves a balance of various factors.
Now I get it, but what about the mental health problems?
What we mean when we say mental health problems is the problems that refers to how someone's mind usually works and their emotional well-being. In other words, mental health problems are the problem of a person that affect their thoughts, feelings, behaviors, and their psychological functioning.
Oh, so it means mental health is how someone feels and thinks in their mind? Is it because mental health problems have a noticeable impact on a person's thoughts, emotions, and behaviors, and it can be diagnosed as it is?
Yes. Actually, there's a lot of different types of mental health problems and disorders. Do you want to know all of them?
Yeah, sure.
Well, the first type of mental health disorder is anxiety disorder. It is a disorder that leads to overwhelming fear responses. These include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Next is mood disorder. A mood disorder is when someone's emotions and moods get messed up. It can make them feel really down or have extreme ups and downs. These mood changes can affect how they go about their daily lives. Treatment like therapy or medication can help them feel better. The other one is psychotic disorders. This disorder messes with how a person thinks and understands things. The common symptoms that psychotic people have are hallucinations and delusions. It can also be a symptom of schizophrenia. And lastly, eating disorders. It's characterized by intense emotions, attitudes, and behaviors related to weight and food. There are 3 types of eating disorders. First one is anorexia nervosa, where an individual severely limits their food intake. Second is bulimia nervosa. They are overeating and have compensatory behavior. And lastly, binge eating disorder. They consume large amounts of food in a short period of time.
That's a lot of disorders, huh?
That's a lot, but she's not done yet.
Oh, really? So what are the others?
There are also impulse control disorders. This involves difficulty resisting harmful urges, like starting fires or stealing. In addiction disorders, people with these disorders may neglect responsibilities and relationships due to their intense focus on addictive behavior. And the personality disorders, like antisocial, obsessive-compulsive, histrionic, schizoid, and paranoid, mean having very fixed and intense behaviors that can make a person feel upset. Example of this is antisocial personality disorder. Individuals with this disorder often show a consistently not caring about other people's rights, lying, impulsivity, irritability, aggression, lack of remorse after hurting others, and a failure to conform to social norms. It can significantly impact the relationship and interaction with others.
Wait, how many disorders have you both discussed already?
4?
Shut up! We haven't discussed the obsessive compulsive disorder and post-traumatic stress disorder yet. Okay, Obsessive compulsive disorder, or OCD, is a condition where individuals experience persistent, distressing thoughts or fears known as obsessions. In response to these thoughts, they engage in repetitive behaviors or rituals which are called compulsions. Imagine a person with OCD who has an overwhelming fear of germs. Despite knowing it's excessive, they compulsively wash their hands numerous times throughout the day to ease their anxiety. This constant ritual is driven by the obsessive fear, illustrating the cycle of thoughts and behaviors in OCD. Post-traumatic stress disorder, or PTSD, it is a condition resulting from a deeply distressing event, such as a violent assault or sudden death. It involves persistent thoughts, memories, and emotional numbness, affecting our daily life and well-being.
Some mental health issues are not as well known. They come in different types, each with its own way of affecting people. These conditions may not be talked as much, but they need special care and attention.
Like what?
Like stress response syndromes, dissociative disorders, factitious disorders, sexual and gender disorders, somatic symptom disorders, and tic disorders.
Did you know that mental health issues come from various potential causes?
Maybe because of issues like childhood abuse, trauma, social isolation, and discrimination. It can be poverty, bereavement, stress, unemployment, homelessness, caregiver roles. It can also be drug and alcohol misuse, adult domestic violence, and physical causes like head injuries or neurological conditions that can cause of mental health issues.
Wow, you've already learned it.
Of course. Hey Shane, can you tell me some symptoms about mental health problems?
Yes, sort of excessive feeling of guilt, fears, and worries. Problem with alcohol or drug use, major changes in eating habits, detachment from reality, paranoia or hallucinations, confused thinking or reduced ability to concentrate. And lastly, the most important is when you're having a suicidal thinking. Why did you ask? Do you have any of them?
I think there's none, but are there any chances to treat people who have mental health problems?
Also, prescription medicine is often used to treat mental health problems by adjusting the chemicals in the brain that
Of
affect
course.
our emotions.
Consulting with psychotherapists can help you. There's a type of treatment, also known as counseling, that is often
There is
referred
also this
to
kind of
as
treatment,
talk
right?
therapy
Is it
because it
something called
involves
as support
talking
group?
with a mental health professional. Because support groups
However,
are a type of
it's not
treatment
just
where people
about
come
chatting.
together
It's
to help
structured
and
and
understand each
purposeful
other,
conversation
especially
aimed at
dealing with
improving your mental
well-being. It is a method where it's like a friendly gathering where people who understand what you're going through by sharing their stories and ways to cope.
Can you give me some advice to maintain good health?
I'm not a therapist, but based on what I read, they said that to maintain good mental health, you should consider avoiding alcohol and drug use. You need to stay active on managing symptoms of mental health problems. Refrain from making important decisions during severe symptoms. Manage time, energy effectively, and adopt a positive attitude to enhance your life and health.
Why did you open this topic? Are you going through something?
I'm good.
Hey, if you have any problem, you can talk to us, huh? You can make us your support group.
Yeah, keep your mental health in good condition. Call us if you're going through bad things. No biggies, just remember that your mental health
your
matters.
mental health matters.